Step 36. Egg quality. After collection of eggs during IVF, your embryologist and your specialist assess your egg quality according to these four categories: quantity of your eggs, quality of your eggs, maturity of your eggs, and function of your eggs. In terms of quantity, you count total number of eggs you got from that IVF cycle. That reflects how your ovaries responded to stimulation. If you had a large number, that means you had a very good response, maybe even over response. If you had a low number, that means you had a low response. In terms of quality, the quality of eggs can be assessed during ICSI, because in ICSI you strip off the eggs from surrounding nursing cells. So you can directly look at the surface of the egg with powerful microscope, and you can check the quality of the eggs to check if there are any defects on the egg. That's called morphological assessment, which you cannot do in IVF, because in IVF you leave eggs with sperm overnight. The next day you can only check the maturity of the egg. One of the benefits of ICSI is the assessment of the quality of the eggs. Then you can check the maturity of eggs during IVF for ICSI. Mature eggs are called M2 because they have gone through M2 metaphase 2 division, and they have a polar body, one single polar body. That's called M2 eggs. That's what we want from IVF cycles. Then you may get immature eggs. They're called GV or M1. In terms of function of eggs, you can assess function by the outcome in terms of embryo quality and pregnancy and live birth. If you had lots of eggs and if you had lots of drop-off rate, and if you didn't get many embryos despite having good quality sperm, that indicates maybe there's some issue with egg function. Here we are going to focus on the assessment of quality of eggs during ICSI. Like we said, in ICSI, after the egg collection, within a couple of hours, the embryologist prepares your eggs for assessment for maturity and quality. They remove the surrounding cells from around the eggs and directly look onto each egg under powerful microscope. They assess morphology and maturity. In terms of a healthy egg, so normal M2 or mature egg should have round, clear zona pellucida. That's the zona which surrounds the egg. Should be very round and clear, and should have a small perivitellin space. This is a perivitellin space surrounding the egg. In that perivitellin space, you should have a small, single, not fragmented polar body. What happens is after you give your trigger shot, before your trigger shot, eggs have 46 X chromosomes. After the trigger shot, once egg goes through the maturation, keeps 23 chromosomes and throws away 23 chromosomes into this polar body. If this division has been completed, you should have one single polar body which has got 23 chromosomes, which will not be used by the baby. It's thrown away polar body. If you don't see this polar body, that's called M1 egg. That's immature egg. You cannot utilize. You need to discard that egg. If you cannot see the polar body, and if you have something called germinal vesicle in the middle of the egg, that's called GV egg. So that's also immature. You cannot use this egg. You need to discard this egg. If your eggs are marked as a M1 or GV, these are immature eggs. So if your eggs assessed as M2, that's called mature eggs. That's what you want. And then also the cytoplasm or whole surface of the egg should be pale, moderately granular cytoplasm with no inclusion. You should not have any inclusions here. That in the picture you can see this is a healthy and mature egg. Now let us look at how unhealthy eggs look like. So you can see from the even picture, these eggs are not similar to the egg picture we saw earlier. Unhealthy eggs may have abnormal zona, and the shape of the egg or zona is not normal. It's not spheric, it's elongated here. You can see here. You can see a lot of vacuoles. There's inclusions, which we said you don't want. And here you can see smooth endoplasmic reticulum clusters. And also you can see giant polar body. This is abnormal. This is a very big polar body, and the large perivitellin space. You can see the space between zona and cytoplasm. There's a large area around it. That's abnormal. And also you can see centrally located cytoplasmic granulation here. So you can see that the granulation on the surface of the egg. And refractile body, you can see here refractile body, that's abnormal. And actually a picture image of egg should be, like we said, should be pale, but here you can see a brown outside. These are the features of abnormal or poor quality eggs. Even poor quality eggs can fertilize, can develop into embryo. Some of them can become entirely healthy baby, but the assessment of quality of your eggs during IVF helps us to analyze your IVF cycle. Let us say if you had a good number of eggs, good quality sperm, and had a very poor embryo development or failed embryo development, then you can track back and assume that's most likely due to egg, because we could see issue with the quality of the eggs, which you can do in an ICSI. When you discuss with your fertility specialist, you discuss how many eggs you got, which is a quantity, how many mature eggs you got, that's maturity, and quality of your eggs, that's the quality of your eggs, and function of eggs. You will ask how your eggs performed in IVF. That's mainly assessed by utilization rate. Utilization rate means how many out of fertilized eggs become high grade utilizable embryos. That's a very important indicator of egg function, including sperm function.